Good morning, everyone. Thank you for joining us for this webinar, Integrated Project Management in Hospitals. I am Ashish Bhatia. I'm CEO of Astron Hospital and Healthcare Consultants Private Limited. We'll begin with a brief about our organization. So Astron Hospital and Healthcare Consultants Private Limited is a professionally managed consultancy organization specializing in evidence-based design with a focus on hospital planning, architectural planning, quality and accreditation. The organization is being promoted by Dr. Yashpal Bhatia, who is a very well-known personality in the healthcare space, who has been at the forefront of hospital and healthcare facility management since 1981, along with the team of healthcare and allied professionals, I would say. He was also responsible for bringing quality in our country, which is the National Accreditation Board for Hospitals. And he was the first chairman of the task force, which was appointed by the government to bring quality in healthcare in India. Now, Team Astron is well endowed with the technical expertise and experience to comprehensively assimilate projects in hospital and healthcare activities from conceptualization, planning and designing, execution and operational management to turnkey project management. Our capabilities lies in contemporary and visionary planning of new hospitals, which is equally matched in adapting existing commercial buildings into healthcare delivery facilities. Our design follows function always has been our motto, is equally is the main cornerstone, I would say, to compliance to accreditation requirements and ergonomic comfort for healthcare providers within the facility. We have been doing projects from concept to commissioning in India and countries like Singapore, Kenya, Mauritius, Sri Lanka, among other countries. I would also like to, put a point over here that our organization was the first organization which started off with providing JCI accreditation to hospitals in India. And NABH, of course, we have been, as I had already mentioned, Dr. Bhatia was the main person who was responsible bringing quality in healthcare. So NABH has always been in our blood. And I would say that we have, proudly, I would say, in fact, that we have completed more than 300 projects in NABH. And if we talk about the planning and designing divisions, we have almost completed 65 projects, out of which 12 are medical colleges. So with this, I would like to also introduce Mr. Surinder Kumar, who is also Director of Projects of Astron Group. Now, Mr. Surinder Kumar, he himself is a very well-known personality in the healthcare space. He has been setting up hospitals in India and internationally. His past experience includes working in Fortis, where he had developed all the Fortis hospitals. So all the hospitals of Fortis has been, developed under his leadership, I would say. And he has been the one who has been supervising the development of all these projects. Second, I would say he has also been responsible for developing almost 45 hospitals in Cambodia. And he has been working in countries like Congo, Bangladesh, Uzbekistan, Nigeria, and many more. So with this, I would request Mr. Surinder Kumar to take over from here. And before starting off with the webinar, give a brief introduction about himself. So.
Thank you, Ashish. Thank you for a nice introduction. Good morning and welcome one and all. My name is Surinder Kumar. I am a project management professional. I have been working in project management space for the last 35 years. My initial 15 years were in managing projects of industrial plants. And for the last 20 years, I am busy setting up hospitals in India and abroad. As most of participants in this webinar belong to healthcare field, you must be aware that hospital project is a very, very unique project and throws many challenges to project managers. While setting up a hospital, you have to deal with great number of stakeholders. And in India, mostly the project management of hospital is given to companies who are mostly dealing with construction management. So the idea of integrated project management, which we'll be discussing today, is basically about integration of all the processes of hospital project. So it starts well before the construction of hospital starts. As most of you are aware, since you are working in healthcare field, hospital projects are different from any other commercial or hotel projects because we deal with grieved people here. We deal with sick patients. People don't come to hospitals for joy or enjoyment. They come here to seek better health for themselves, for their relatives. So it is very important to engage an agency who has a 360-degree knowledge of not only setting up of hospitals, but must have also operated and learned from it in the past. So the topic today which we have selected for this webinar is integrated project management, which means that all the stakeholders of the hospitals have to be involved right from the beginning of the project. We have prepared a small presentation, and I'll request Vikram to help me in this navigating through this presentation. May I request for the next slide, please? So before I start talking about project management, it is very important to understand what are the challenges which one faces while setting up of hospitals. The first and foremost point which needs to be taken into consideration is the location of hospital. Because location can make or break any project. As you might have experienced, and we have experienced also, a bad selection of site can lead to various unforeseen challenges in hospitals. For example, if there is a site which has a problem of access, then all the beneficiaries will find it difficult to reach hospitals. So accessibility has to be there. Apart from it, if site poses different challenges in terms of water table. If, say, water table is very high, sometimes the cost of dewatering is more than the cost of construction itself. Similarly, other geotechnical parameters of site like soil bearing capacities, low lying lands also throw many challenges which can result in huge financial burdens on the project. So it's very important to engage an expert agency for selection of site. Now, all hospitals are governed by strict rules and regulations, not only for projects, but for operation itself. So there are about more than 60 clearances which are required to run a hospital. And for setting up of hospital, you have to have 5 to 6 clearances even before you start excavation of the hospitals. So it is very important for agency who is managing the project to be well aware about all these regulations so that project commissioning is not delayed on account of any of these challenges. I will not spend much time on ROI because this is very obvious point that any project promoter would expect return on its investment. So it is very prudent on every stakeholder to consider this point very, very judiciously. Availability of medical talent is another important challenge which is faced by all the hospitals. That's why it's all the more important for hospital to be positioned and designed in a way that it attracts medical talents and people will be interested to join these hospitals. Shortage of nurses and paramedics is well known, especially because of this current COVID situation, which all of us have recently experienced, and how important it is to have proper nursing and paramedic staff. So there's a challenge in our country for shortage of nurses and paramedics. Then the agency who is involved in setting up a hospital have to have a right fit and right medical program for that particular hospital. So if an existing hospital needs expansion, a great amount of study is required in existing facilities which are available, and experts have to recommend the new medical program which is in synergy with the existing program. So the team who has experience of operation of hospitals and setting up of projects come very helpful in setting up of hospitals, and hence selection of project management team and planning and design team is very, very important. For planning and design of hospital, we'll be discussing in detail in subsequent slides. Let's come to medical technology. Every day we hear about new medical technology innovations, and it is very important to keep oneself abreast with the latest technology. Another biggest challenge which is faced by almost all the projects are cost overruns and time overruns. That's why the integrated project management becomes very, very relevant for setting up of any hospitals. Next slide, please. So to understand a hospital project, it is equally important to understand that what is the life cycle of hospital projects. So when we talk of projects, the first thing comes to our mind is the construction. So that's why we thought it fit to bring this topic today, that project management of any hospital project is not just the construction. They're about good 6 to 7 months or sometimes 12 months required to come to a stage when you can start construction of a hospital. And the time spent in planning and designing of hospital will save in construction time, the cost overruns, and the time overruns. So for the life cycle of hospital projects, before a promoter makes up his mind to set up a hospital, or any existing hospital chain decides to set up a new projects, there are a lot of analysis which goes in the background. Those could be demand and supply gaps, market research, and various other studies. So based on this analysis, promoters will make his vision for setting up of a new hospital. So it is very important for project team to understand and have clarity about the objective and the vision of the promoters. All subsequent planning, designing, and project management activities have to align with the main vision of the promoter. And if there is a gap, it has to be quickly discussed and resolved. Because if there's a mismatch between vision and the final product, everybody is going to have issues around it. So once vision of the hospital is properly understood by all the stakeholders, by stakeholders I mean for a hospital project, there's a huge list of stakeholders which come into play. For example, the administration team who has to run the hospitals, the finance team who are responsible for cash flow and for revenues, the human resource department who will plan the manpower for the hospital, safety and security team who are responsible for safety of staff, healthcare staff and patients, nurses, doctors, licensing, and marketing team. So all these teams have roles to play, and the inputs from these teams are very, very important for project team to synergize in their plans. So sometimes hospital planning starts without even knowing the population of the hospital. If we are setting up, say, 300-bedded hospital, it is very important to know what would be the footfall in the hospital. And this information can only be assessed by an experienced team who has experience of setting up and running the hospitals. Because the footfall is a very important factor for any hospital, which would determine the design of waiting areas, the vertical movement, the horizontal movement, various design of kitchen, laundry, and things like that. So before planning and designing, a feasibility study is conducted by way of primary and secondary research, and then a right mix of specialties, medical programs, hospital support services, engineering services are arrived at. So the procurement phase of the hospital project deals with various contracts, tendering, procurements, logistic supports, and this can also derail the projects if not planned properly. Now, the integration of medical technology is a very, very special field, and we have to rely upon experts like biomedical engineers and doctors who would advise the engineering team, project team, and hospital support services team in fulfilling all the requirements which are required for integration of these medical equipments and technologies into the main project. So there's as I mentioned earlier, medical technology is one field which is undergoing great innovation at this time. Every day we hear of new machines which are coming into the market, and one has to very selectively select these technologies because there's a huge cost difference between various models and the various technologies. Setting up of operation team is also part of a project, and an experienced team is required before we start pre-commissioning activities. So this team has to be present when we start pre-commissioning activities. That's why we are talking about integrated project management, because it's not just construction of hospital. This hospital which is being made for has to be handed over to a team who has to run it. So their inputs and their involvement has to start about 7 to 8 months before hospital starts functioning. So once the team is here, then we have to start pre-commissioning activities, which would, department-wise commissioning of the departments, and operation team has to be involved in pre-commissioning activities so that if there are any hiccups, that can be taken care of. So after this phase, the commissioning phase of hospital starts, where either it can be a soft start of the hospital, where we can have dummy patients and feedback is taken from all the departments, and any loopholes, if any, can be plugged before we open the hospital for general public. Next slide, please. Now, by definition, integrated project management is the solution to haphazard management techniques and instinctive managerial actions. By understanding, sharing, and codifying processes and knowledges across the entire organization. Doing this gives a broad understanding of each project and its requirement. It helps to share knowledge and processes across projects, making for healthier organization. So integrated project management, which I'll be referring to as IPM, is a paradigm shift in project management. So it is very important to understand that we must have process-oriented approach for making projects and for the entire life cycle of the project. So this IPM is an organizational level exercise, and all these processes have to set up across organization. So which will help the project team in delivering the project in the agreed parameters of cost, time, and quality. So there has to be seamless integration between vision, operation team, project team, quality team, and all the stakeholders. So the clear roles and responsibilities of each and every member have to be clarified, and the role of project manager becomes very, very important. He becomes like a conductor of an orchestra who is conducting various operations simultaneously, and effective communication is very, very important in delivering projects. If we have experts involved in the team for delivering of projects, it goes a long way in evaluating various trade-offs, because at every situation in project, there are trade-offs between competing objectives and options. For example, if you have to procure medical equipment, which is, say, state of the art, and cost is very heavy, so the experts can come in and advise the team what are the pros and cons and what are the trade-offs in selecting these machines, and whether this equipment fits in our overall financial plan or not. Similarly, there is always a debate which goes in the minds of project team and stakeholders about CAPEX and OPEX debate. Sometimes the equipments which are very, very energy efficient and very state of the art, their capital cost is very high, but their operating cost is very low. Similarly, operating cost can be very high and capital cost can be low. So there is always a trade-off between these choices. That's why it's very important to have various experts who would advise in selection of these equipments. So integrated project management is a process-oriented approach which will have process for everything, even risk assessment and mitigation. Next slide, please. So what are the various phases in integrated project management? The first phase is project initiation stage. So during project initiation, there are various studies which goes into play. Like as I told earlier, in project initiation stage, there's a lot of meetings which happen with top management of the project team to understand vision and mission, the feasibility, the business plan, the market research studies. So it's very important to integrate management's vision into project management. So once the decision has been taken by management to start a hospital project, the first step would be to establish a project organization. Project organization will have clear objectives, the clear scope statement of the project. Various participants and stakeholders will know about their roles and responsibilities, and authorities and responsibility metrics will have to be finalized in this setting up project organization. This is a very, very important step in making the project successful. So by having clear processes around projects, it becomes very easy for decision making, and slow decision making is very, very detrimental for the health of projects. Similarly, we have to have proper cash flow statements and arrangements for funding of the hospital, because any shortage of funds flow will very severely harm the project, and it will result into cost overruns. Then the next phase of project is project scope. The specific targets, goals, and milestones have to be set up, and work breakdown structure will have to be made for each and every step of project. This will help in planning various activities, having Gantt charts, either CPM networks or PERT charts. Then a suitable project management plan has to be prepared. In project management plan, normally we have 4 phases, which is design and management. Then there's procurement. Then there's a construction management, quality control, safety management. So each of these project management plan should have the processes around itself, so that there is no lack of communication, and subsequent activity gets started once the previous activity gets completed, and there is an alert every time, and there's a notice given before start of next activity, so everybody is well prepared to take on the baton and complete the project smoothly. Coming to the construction management plan, which is a very important part of the project. In this plan, various components of projects and delivery processes have to be very carefully charted. Activity-centric plans have to be prepared, and velocity of every activity has to be assessed, and it link with all subsequent and preceding activities have to be established, and so that you know whether we have a float in any activity or there is no scope of slippages. Important milestones will have to be established, and measurement of activities in terms of its performance have to be mapped out. Then there is a project monitoring plan. Unless we can measure each and every activity of project, it is very difficult to find a remedial action. So the project monitoring plan have to have a baseline, which is an ideal schedule, and which will keep on changing during the tenure of project, depending on various impacts on it. And there has to be a process of changing the project plan, and which would have proper authorities and responsibilities. Suppose there is a change in any of the project plan, So there has to be process around it. If initial vision had not provided for this change, then this approval needs to be done by top management so that everybody is aware of the changes and its impact on the overall project plan and to reduce heartburns later on. Similarly, there'll be a change control plan because circumstances and requirements change as the project progresses. Some resources become unavailable. There are sometimes force measures, as we experienced in the last year due to COVID. Most of the projects were stopped, and sometimes pollution control boards puts embargo on construction plans. So there are some activities which are under our control, and sometimes we are faced with situations where things are beyond our control. So all these evaluation of changes have to be taken into consideration, and evaluation of change requests and measuring their impact on project performance have to be assessed. Next slide, please. So I'll briefly discuss about each phase of this. As I told earlier about project initiation, vision and mission statements have to be very clearly understood. And the positioning of the hospital. Sometimes there's a confusion because design teams puts a lot of materials which may not fit into our budget. So it is very important to understand how a particular project is being positioned, who are the target customers, and that would determine selection of equipment, selection of materials, and various other things. Similarly, the business plan has to be respected by everyone. Unless we adhere to business plan, the cost overruns will eventually derail the project. Same goes for ambience of the hospital. We have to have a healing ambience. That doesn't mean that we have to put costliest of materials. By proper design and experienced architectural and design team, a required ambience can be created with various kinds of materials, irrespective of their cost. So only thing is there has to be clarity in our minds as to what is required of the project. Next slide, please. So participants and stakeholders for project organization, as I mentioned, there's a huge list of stakeholders, and it is very important to keep transparency and open communication with all the stakeholders, and we have to have agreement with all the stakeholders so as to have their buy-in in the project. The objectives of the project have to be clearly communicated, which would help in designing and management of the project. Authorization and responsibility of project managers has to be clearly defined so that he takes onus of delivering the project in agreed time, cost, and quality. Next slide, please. The scope statement of project has to be announced in the organization so that everybody is aware of the limitations of the scope, and the wish lists of every department have to be curtailed to fit in the scope statement. Sometimes there are demands of change in scope, which would lead to changes, and this will impact business plan. So a proper process is established to incorporate these changes if required. Specific targets, goals, and milestones will have to be established and monitored and announced to everyone so that everybody is aware of any slippages and delays. The work breakdown structure in terms of each minute detail of the project, say for example, excavation, structure, interiors, MEP services, landscape, facade, everything have to be clearly planned so that they fit well in the project schedule. Next slide, please. So project management plan is a very important phase of the project. And as we discussed earlier, I can't get enough of discussing hospital planning. So it is very, very important for the success of project to have a well-robust hospital planning team who have experience of setting up and managing the hospitals. It is very important for project to become successful that people who are planning the hospital know the nuances of hospitals. As I mentioned earlier, there's a huge criticality factor in hospitals. So for example, there has to be standby for critical equipments. We can't afford any breakdown in managing critical patients. So there has to be 100% backup of electricity. And in unforeseen circumstances where even backup fails, there has to be adequate arrangements. So in hospitals, the criticality of services is of utmost importance. So in hospitals, we have main power, then we have diesel generating sets as 100% backup. And in the most uneventful state, if even DC fails, there are uninterrupted power supply UPS systems. And in any disaster, even if UPS fails, the critical equipments have their own life-saving equipments, have their own backups. So it is very important for team to understand the criticality factor. Similarly, the safety of patients is very important. The patient fall has been a major concern in hospitals, and it results into accidents for patients. So while designing, it is very important to understand that all the fittings and furniture and nooks and corners are so designed that patients don't hurt themselves. Similarly, the health of healthcare providers is also very important. In that sense, it becomes very important to have indoor air quality parameters fulfilled so that the hospital acquired infections for patients and for healthcare staff is given due consideration. Again, at the sake of repetition, I would say it is very, very important to engage a hospital planning team who has immense experience of planning and designing hospitals. For design and engineering, the architects, engineers have to plan the hospital in a way which fits into overall vision and plan of hospitals. Again, architects and engineers have to have good experience for designing and setting up of hospital, because this is again, a very important piece. So for creating healing ambience, as I told earlier, the role of architect is very important because his design have to be based on evidence-based approach. It has been well established that for patients to recover, there is a certain scientific design approach which results in faster recovery for patients. It is well known that ICUs which have no sunlight can result in ICU psychosis for patients, and delays in patient recovery. It makes all the difference for patient rooms and ICUs to have windows and view for patients to outside. This goes long way in setting up their biological clocks and faster recovery. Similarly, meeting of family members can hasten up the recovery of patients. The hospital has to be so designed that the attendant of patients have a comfortable stay, and they can provide support to their family members and loved ones. The procurement phase is very important from logistic point of view, for tendering, for delineating various contractual conditions, and to prepare a plan wherein the cash flow and the supply of equipments gels well with overall project plans. There are often situations where either materials arrive too early, thereby blocking up the capital, and the important equipments gets delayed because of lack of funds. So it is very, very important to align the procurement phase with overall management plans. Similarly, sometimes the site is ready, but equipments are delayed. So it is very important to dovetail the supplies and construction. So for construction manager, the biggest worry in the mind of construction managers are the safety. The safety of the site have to be managed well, because any major accident can derail the project. So we always say that before everything else, safety of the site have to be uncompromised. All the safety precautions, even before the construction starts, have to be well established. The process of visitors to the site, there has to be process around it. There has to be disaster management plan, and there has to be PPE for all the construction workers, for all the project team. They have to protect themselves from any accidents. So for that, a well laid out construction plan have to be established. Integration of medical technology, again, we discussed it earlier. This is a very, very crucial phase. To bring in medical equipments when there's dust at site is detrimental for the health of medical equipments. So construction manager and project manager has to ensure that when we start bringing in medical equipments into the site, there has to be a dust-free environment. There has to be air control. The HVAC has to be commissioned for certain part of the hospital where erection of medical equipments can start. The commissioning phase of the hospital starts when there is an operation team, and with the involvement of operation team and with involvement of all the stakeholders who are required to start the hospital, the commissioning activity is well recorded, and if there are any hiccups, they are recorded and mitigation measures are taken care of. So while handing over to operations, it is very important to document each and everything. So here, document control management becomes very important. So when we hand over to operations, all the licenses, all the statutory requirements, list of assets, list of machines, the manuals, everything have to be well documented and presented to operation team. Next slide, please. So I'll not spend much time on this. We have already discussed in detail. So this is a construction management process where activity-centric plan has to be well established. Delivery processes have to be established. Quality plan, quality again has to be inbuilt in the system, because any failure in the quality plan can ruin the project. I discussed about safety already. Resource plan in terms of construction materials, in terms of labor, in terms of various other elements of project. And there has to be a risk register maintained at site. If a project manager foresees any risk in meeting the deadlines, he has to announce it to all the stakeholders, and an emergency meeting is required to mitigate the risk so that we can minimize the impact of this risk on the overall project management plan. Next, please. So for monitoring the project, a project monitoring process has to be established, which would have a baseline, which is the ideal project schedule. And based on this, the routine weekly, fortnightly, monthly meetings, coordination meetings happen at site, and the velocity of the activities is assessed, monitored, and informed to all the stakeholders. The gap analysis is studied, and risk mitigation plan is prepared in consultation with all people involved. Next, please. So change control plan goes long way in smoothing the process of projects, because as I mentioned earlier, along the life cycle of projects, because hospital projects are, would go on for 18 months to sometimes 24 months, and during this time, a lot of changes take place. So there has to be a very robust process around it, so that at every stage, change of scope or any other requirement is well documented. Change of circumstances, change of requirements are well documented and informed to all the stakeholders. All the change orders which are presented have to be evaluated. Their impact on the project has to be established, and then project plans have to be revised once this change have been approved by respective authority. Next, please. So as I mentioned earlier, document control management is a very important piece. So there are various softwares available which can be deployed in document control management, which would document all the correspondences throughout the life cycle of project, so that it becomes very difficult to retrieve any information which may be required later on. And sometimes these information get lost, and it becomes difficult to retrieve this information. So there has to be a good document control management in the project. For example, the drawings list, all the assets which are there have to be barcoded, and there has to be asset register, which is maintained and then handed over to the operation team. The punch lists and checklists are prepared for each and every contract, and the project management team has to ensure closing of these checklists and punch lists, and the criticality of these checklists have to be assessed and taken care of. Then financial closure of all the contracts is a very important aspect of projects. Otherwise, this can lead to litigations and other problems. Defect liability period has to be managed by project team with various contracting teams, and the project is handed over to operations. So we have to understand that project has a beginning and end, but the process are continuing activities which can be repeated to next projects. So that's why integrated project management approach is a process-oriented approach, which would help all the stakeholders of the project in managing the project well. Next, please. So it is very important to have an agreement of every stakeholder. So if there is any debate around any aspect of the project, this has to be well discussed and then agreement has to be reached. So there's always a trade-off at every stage of project. But once the decision is taken, then everybody has to follow that route. So organizations have to tailor the processes. There's no one size which fits all. Every organization has to have processes as per their requirements to help the project be successful. So there has to be clear communication between different stakeholders, and communication protocols will have to be set up. And we have to differentiate, as I told earlier, between process and project. So processes are ongoing things which can be repeated and they are scalable. Project can't be repeated. Project is a one-time activity which is definitive, start and end. So in conclusion, integrated project management is the solution to haphazard management techniques and instinctive managerial actions. So by understanding, sharing, and codifying processes and knowledge across the entire organization, doing this gives a broad understanding of each project and its requirement. It helps to share knowledge and process across projects, making for healthier organizations. Thank you very much. And now I would request Vikram to open the floor. I'll try to answer questions to the best of my capability, and I don't promise to have all the answers, but I'll try my best.
I request to all of you that please raise your hand if you have any questions.
Hello.
Yeah, Mr. Anuj.
Yeah, hi. I would like to ask this question to Mr. Surinder ji. When do you think a client should engage a construction, or a PMC or a construction management company in the project? At what stage of the project they should be engaging them?
So Anuj, my idea of integrated project management is that this team, client has to engage a team who has an integrated approach to the project. So construction alone, if we engage agency which would manage just the construction, the knowledge of project management comes in silo. So it is advised that if client engages a team which has a holistic experience of establishing project, and construction management must be part of that team. That is my suggestion, and I'm open to any advice on this.
Right, sir. Sir, and when we look at a company like an integrated who can do all this integration together, would it mean that hello?
Yes, please.
Can you hear me, sir?
Yeah, I can hear you.
All right. So the question is, what should we look? I mean, what should be the criteria of looking upon for identifying this kind of companies?
Yeah. So as I mentioned in my discussion, a team who has experience of not only designing and setting up of hospitals, the project team must also have experience of operating the hospitals. So company like Astron, who have integrated project team in by having people who have operated hospital, who have designed hospital, who have done accreditation, who have done quality analysis, become very important for the success of the project.
Right. So that means, sir, you suggest that people having an expertise on the operations will help more for designing of the projects also?
Sure. And who can understand it more than you, Anuj? You have huge experience in projects, and at times we have to trade off between various decisions in terms of medical technologies and various hospital processes like admission and discharge and patient care. So it's very important to have an expert and a hospital planner who has the experience of even running the hospitals.
All right, sir. Fine. So that's from my side.
Thank you, Anuj.
Thank you.
Are there any other questions? So I understand there are no questions, and I thank one and all for joining this webinar. And with this, we close this webinar and hope I could make some impact for this integrated project management on all of you. Thank you so much.
Thank you so much, Surendraji, for a very informative session here. Of course, looking at the paucity of time, of course, we would request everyone that if you have any questions or queries or any kind of support which you require from our organization, you can reach out to us on contact@astronhealthcare.com. And again, I would thank everyone for participating in this webinar. We hope that you would have taken some information and good knowledge out of this whole session. So thank you again. Thank you, everyone. And please stay safe. Jai Hind.
Thank you, all of you, to participate in this webinar. We hope we will get in touch once again